Dr. Julia Turner, and I'm going to tackle the awful question of who has the most chance of dying from coronavirus. So from the data from China of 44,000 people, we saw that people under 40 years had a very low chance of dying. However, from 50 to 59 years old, the chance increased to 1.3%, which is 1 in 76. From 60 to 69 years old, it increased to 3.6%, which is 1 in 27. And from 70 to 79 years old, it increased to 8%, 1 in 12 people, and over 80 years, 14%, which is 1 in 6 people died. So you can see that there's much higher risk of dying if you're over 50 years old, and this risk increases exponentially as you get older. So some people also had underlying disease, and this caused them to have much more severe disease. So who was this? So it's people with high blood pressure, diabetes, heart disease, lung disease, liver disease, kidney disease, and immunodeficiency disease. So in South Africa, we have people with all of these diseases, so we are very worried about them. We also have the added burden of HIV and malnutrition, which causes a lot of immunodeficiency. And we have lots of people with TB, which causes lung disease, that we are worried about. So in South Africa, we have about 7.7 million people with HIV. About 5 million of them are on ARVs, but about 2 million are not on ARVs. So the ones who are on ARVs, most of them will be taking their medicine. They'll have a suppressed viral load and a good CD4 count, which means that their immune system is strong and can fight diseases. But some of them won't be taking their medicine correctly and have a high viral load and a low CD4 count and a weak immune system. Out of the people who aren't on ARV, some of them don't even know that they have HIV, and some of them just stop taking the ARVs. So the people who have good viral loads and CD4 counts and are taking ARVs, we are not worried about. We don't think that they have an increased risk of severe coronavirus. However, the people who aren't on ARVs or aren't taking them correctly, we are worried that they have a risk of severe coronavirus. So we want to encourage anyone who doesn't know their HIV status to get tested, and anyone who isn't on ARVs to restart immediately and to come see the clinic if your viral load isn't good, to make sure that we get your viral load suppressed and a good CD4 count so you have a strong immune system. We also encourage everyone with HIV to get a flu vaccine, as we don't want you to get flu and then coronavirus as well, as you now will be at increased risk. So in TB, also in South Africa, we have a high burden. About 250,000 people get TB every year. So anyone who has a TB contact or a cough or a fever or night sweats or loss of appetite or loss of weight, please must come to the clinic, get tested for TB. If they have TB, we must get them on treatment immediately so that we can keep their lungs as healthy as possible so that they aren't at too much greater risk of dying if they get coronavirus. Also, we have TB preventive therapy, which is great. So people with HIV must please come and take TB preventive therapy. It's just 1 tablet a day, and you can take it for a year, and it will prevent you from getting TB. Then we have people with other chronic illnesses like high blood pressure, diabetes, etc. Please make sure that it is stable, that your sugar or your blood pressure is well controlled. This means you must take your medicine every day. The clinics are not closing. You must still go and collect your medicine. If you can get onto a CCMDD or external pickup point program, do that so that you don't have to go to the clinic, but you can still get your medicine, get a large supply so that it'll last you. And please take every precaution possible so that you don't get coronavirus. So you might be wondering, what about pregnant ladies? So we haven't seen an increased mortality rate for pregnant ladies from coronavirus compared to if they weren't pregnant. And we also haven't seen any direct mother-to-child transmission. That is, that we can't find coronavirus in amniotic fluid, in the birth canal, or in breast milk. So it's still safe to have a baby and breastfeed, but the most likely route of transmission that your baby would get coronavirus from you is from your respiratory droplets. So if a mother has coronavirus, they need to wear a mask while they breastfeed. They need to take every precaution possible to not spread it to their baby. So in summary, the people we really need to protect are the elderly, anyone with any other illness, and of course pregnant ladies we want to protect as well, because we never know what long-term effects it might have on a baby. If you are any one of these people, please take all precautions not to get coronavirus. Please remember that the biggest warning sign is shortness of breath, so if you have any difficulty in breathing, please go to hospital immediately. Thank you for listening. Please look out for more videos like this. These are the hotline numbers you can call.